Hello everyone, and welcome back. In this video, we'll talk about osteology that is essential for the radiographer. This is not general anatomy. We'll focus on what bones mean for X-ray imaging, which will enable you identify them easily while you take clinicals. Osteology is the study of bones. For radiographers, osteology is not about memorizing every bone detail. It is about understanding bone structure, alignment, landmarks, and radiographic appearance. The human skeleton, like all other animal skeletons, in general, provides support, protection, movement, and attachment for muscles and ligaments. Radiographically, understanding skeletal structure enables us to assess fractures, evaluate alignment, identify pathology, and confirm correct positioning while we take care of our patients. The skeleton is divided into two main parts. The axial skeleton, which includes the skull, spine, ribs, and sternum. It is highlighted in blue. And the appendicular skeleton, which includes the upper and lower limbs, as well as the shoulder and pelvic girdles. It is highlighted in yellow. Understanding this division helps with image labeling and positioning logic. This enables you as a radiographer to understand more about the condition of your patient and provide better health care. Bones are classified according to their shape. As radiographers, we focus on 5 main types, which are crucial in assessing radiographs. Long bones. These bones are longer than they are wide. They are characterized by having a central shaft and 2 expanded ends. They are located in the upper limbs, with the humerus, ulna, radius, metacarpals, and phalanges. Also in the lower limbs, with the femur, tibia, fibula, metatarsals, and phalanges. These bones act as levers, support body weight, and facilitate movement. These bones are commonly examined for fractures and alignment. Short bones. These bones are cube-shaped, roughly equal in length, width, and thickness. This group includes the carpal bones of the wrist and tarsal bones of the ankle. Sesamoid bones also fit in this group, though we shall discuss them later on. These bones provide stability, strength, and allow for limited motion in the hands and feet. They are often seen in wrist and ankle imaging. Irregular bones. These bones fall in a category of complex, unique shapes that don't fit into long, short, or flat bone classifications. Their intricate forms are adapted for specific roles in their various locations in the body. This classification includes the vertebrae, sacrum and coccyx, the hip bone, skull bones, among others. Due to their complex shapes, they require careful positioning to obtain high-quality images. Flat bones. These bones are characterized by a broad, flattened and often curved shape. They include the cranial bones of the skull, sternum and ribs of the thoracic cage, and the scapula of the shoulder. These are very special because they contain red bone marrow, where most red blood cells are formed in adults. They also protect vital organs, provide extensive muscle attachments, and most importantly, act as key radiographic landmarks for many projections. For the last major group, the sesamoid bones. These are small seed-like bones, embedded within tendons. They act as pulleys during muscle movement, to reduce friction, improve muscle leverage, and protect tendons from stress. The patella, also called the kneecap, is the largest sesamoid in the body. They are also found in the hands, ball of the big toe and wrists. These bones increase weight-bearing capacity and are crucial for movement, although they suffer fractures or inflammation from their overuse. These injuries are common in athletes. It is crucial to note that these bones are commonly mistaken for fractures on X-rays, and thus require careful diagnosis. Understanding ossification, the process by which bone is formed, is quite important in radiography, especially in pediatric imaging. Bones develop by two main processes. Intramembranous ossification, a process by which bones form from mesenchymal tissues of the developing fetus. Flat bones such as the cranial bones, the jaw, and clavicle are formed through this process. Endochondral ossification, a process by which cartilage is replaced by bone material to form bone. Long bones, vertebrae, and hip bones are formed through this process. Bone formation begins at two spots: the primary ossification center and secondary ossification center. Primary ossification centers appear in the shaft before birth. Secondary ossification centers appear in the ends after birth. These centers eventually fuse as an individual matures. Characteristic to these centers are epiphyseal plates, which divide epiphysis from metaphysis and allows bones to grow in length. On X-ray, growth plates appear as radiolucent lines, not fractures. Recognizing them prevents misdiagnosis. The appearance and fusion times are predictable and are used to assess child skeletal maturity, and also these plates explain why pediatric X-rays are always different. Understanding the structure of a long bone is essential for radiographers. A long bone has three main parts. The diaphysis, which is the central shaft. It is long, thick, and strong. It also contains the medullary cavity. The metaphysis, which lies between the shaft and the ends. It contains the epiphyseal plates in growing bones. This area is metabolically active and prone to injury, especially in children. The bone is covered in a tough, fibrous membrane on its outer surface. It supplies the bone with nutrients and carries the bone blood vessels. The epiphysis, which forms the ends of the bone. It is rich in spongy bone and is covered in articular cartilage. It contributes to joint formation and alignment. Bones are made of two main types of tissue: cortical bone, commonly known as compact bone, and cancellous bone, also called spongy bone or trabecular bone. Cortical bone is solid, dense, and hard. It forms the tough outer shell of bones. Due to its strength, it provides structural support and protection. Cancellous bone, on the other hand, is porous and honeycomb-like. It is composed of a network of tiny bone rods, called trabeculae, with spaces in between. This bone tissue is found at the ends of long bones, vertebrae, and ribs. The difference between these two bone tissues explains why fractures behave differently, why osteoporosis affects imaging appearance, and why bone density matters clinically. Recognizing cortical and cancellous bone patterns is fundamental in image evaluation. This radiograph clearly shows the distinction between cortical and cancellous bone tissue. Cortical bone appears bright white on the image because it absorbs more radiation. Cancellous bone appears as a gray pattern with visible trabeculae.